Another possible cause of red blood cell destruction in the body is it could be that it is as a result of drugs. Maybe the patient was under some drugs and all that stuff, right? And it leads to what? The destruction of red blood cells. Okay? So, but before this destruction can happen, there needs to be what? A modification in the membrane. Okay? So the membrane will modify. Alright? Modify, become weaker, and that's basically what will give chance to the destruction and all that. Right? So it's just this modification that we are talking about, right? So the drug will come, bind to the red blood cells, form a drug-dependent antibody mechanism, thereby weakening the red blood cell and leading to destruction of the red blood cell. Now, let's talk about this. Let's have an overview before we talk about the mechanism, which is here. First of all, let's define what a drug-induced autoimmune or immune hemolytic anemia is. All right. So the drug-induced autoimmune hemolytic anemia, also known as drug-induced immune hemolytic anemia, is actually a rare cause of hemolytic anemia. Right? It's something that will rarely cause the destruction of red blood cells, but it actually occurs. Right? So it is actually to differentiate from other forms of anemia, and this can lead to delays in diagnosis and treatment. Okay, so the drug-induced immune hemolytic anemia is actually a blood disorder that occurs when a medicine you have taken triggers the body's defense system, that's the immune system, to start attacking its own red blood cell. Right? So now this can cause red blood cells to break down earlier than normal. Right? A normal red blood cell should last for like 120 days. So if there's a breakdown that is causing the breakdown of red blood cells earlier than normal, that's what is called hemolysis. Okay. So talking about the mechanism now, drugs like cephalosporin can cause modifications of the red blood cell membrane components. Right. So as a result, a variety of plasma proteins, immunoglobulins, complements may actually attach to the red cell membrane. That's via a non-immune mechanism, right? This can result in the findings that if you do a test, you find that the direct antiglobulin test is positive, right? But this can rarely cause immune hemolytic anemia, right? However, drugs like cisplatin, carboplatin, ribavirin in combination with interferon alpha can cause hemolytic anemias by membrane modification. So the simple talk here is this: for this hemolytic anemias that are due to drugs, for them to occur, there must be a membrane modification, which is basically making the membrane weak and predisposing it to easy damage and all that. All right. So this red blood cell modification, red blood cell membrane modification mechanism of drug-induced hemolytic anemias. And bye for now.